Do you guys know, are we doing the closed session in a breakout room or what are we doing with that?
I'm assuming we are.
Yeah, closed session will be in a breakout room.
Thank you.
You're welcome.
There's an angel out there listening to me. Hey, Santa, for Christmas, I'd like,
Like what?
I don't know.
You about ready, Kathleen?
Yep, just give them one more minute and we should be ready to go.
Hey, Kathleen. I see Sandra from Catherine's office on the call, but I don't think we've seen Corey yet.
Okay. Okay.
We good to go, Kathleen?
Whenever you're ready, Mayor.
Thank you. Welcome to our special city council meeting this November 25th, 2020. I'll now call the meeting to order at 6 p.m. For the audience tonight, I'm the mayor and serve as a presiding officer for tonight's meeting. Tonight's public meeting will be conducted utilizing Zoom video communications. This allows the city to conduct essential business and comply with the Public Health Administration recommendation to protect the public and city employees to practice social distancing and limiting exposure by not allowing in-person public meeting. To ensure the public will be able to participate in our meeting, public comment can be submitted as live comments during the Zoom meeting and via email at publiccomment@cityofglendora.org. For tonight's lineup, we have one closed session item, anticipated litigation, and one unfinished business item, COVID update. My statement tonight is we, the City Council, are sensitive to all points of view concerning the COVID-19 pandemic. With the latest Los Angeles County Board of Supervisors meeting yesterday, deciding not to intervene with the Los Angeles County Health Department's new health order affecting LA County and all of Glendora residents and businesses, a special City Council meeting was called to inform and to help provide direction and a path forward. Madam Deputy City Clerk, can you please conduct a roll call?
Thank you, Mayor Alois. At this time, I'd like to conduct an oral roll call. I request that each council member respond with a present when their name is called. Councilmember Thompson,
Present.
Councilmember Friedendahl,
Present.
Councilmember Boyer,
Present.
Mayor Pro Tem Davis,
Present.
Mayor Alois.
Present.
Thank you. All council members are present.
Thank you. I now open up public comment period, inviting members of the public to address the City Council on items listed on the agenda. Speakers are limited to 3 minutes, speaking once. This is your time to speak uninterrupted. Please address your comments to me, the presiding officer. Public comment is limited to 30 minutes. If you'd like to request to speak, select the raise hand icon in Zoom before the close of the public comment period. You will then be called on when it's your turn to speak. Do we have any public comment requests?
Mayor Alois, we received 9 correspondence earlier prior to the meeting, and those 9 correspondences 9 correspondence have been indexed, distributed to council, and made available to the public and incorporated in the agenda packet. 3 additional correspondence have been received via the public comment portal, and I currently have 1 request from a Zoom participant, which I will invite her to speak. Erica. I'm
You're
gonna,
muted, Erica.
Unmute. Oh, okay. All right. Hi. My name's Erica Landman, and I just wanted to say a few things. First, I want to ask any idea when possibly the meetings may go back to normal without Zoom. So I just wanted to ask that before I started. Okay. I truly believe that it's wrong that the health department is unjustly targeting the restaurant industry regarding outdoor dining. Is there any way the restaurants could continue outdoor dining? Will the city offer any assistance for the restaurants? Possibly not requiring license fees or waive permit fees or something just to help them out. I truly believe that the city should continue outdoor dining setups in the future. And of course, as well as have the indoor dining available as well. After, of course, after this COVID craziness ends. And I wanted to also ask, or actually ask regarding Catherine Barger. Have you guys been in contact with her by chance? She's supposedly against this, and she spoke out against the restaurant closure, but I felt it wasn't strong enough, in my opinion. And I really think she needs to stand up for the businesses more. And of course, the entire County Board of Supervisors, they're not on my good list right now. They're on a short list. So that's one thing. And then I hope it's okay. A few residents had asked me a few questions, and I just wanted to put this out. One is regarding having difficulty driving on Gladstone Avenue, Glendora Avenue, a couple other streets in Glendora, and they were wondering if the city is going to possibly restripe the roads. So that's one thing. Also regarding the townhomes on Route 66 and Parker, is there any way to lower the height from 3 stories to 2 stories? And a few people have contacted me regarding the old mortuary on Route 66. Is there any way that the city could do something like they did with the Hostess project down on Arrow Highway and Sunflower? Because that's pretty much a very recognizable building in Glendora. It's quite a landmark, and it's unique to Glendora, and people really want to keep it there. Happy Thanksgiving. Thank you for letting me speak. It was nice to see you. So I'll be popping in again. Okay. All right. Thanks.
Thank you.
Josina,
Okay, can you hear me now?
we can hear you.
Mayor Alouez, City Council, City staff, thank you for allowing me to speak tonight. My name is Joe Stina, President and CEO of the Glendora Chamber of Commerce. The Glendora Chamber, along with many chambers throughout the San Gabriel Valley, were very busy yesterday trying to disseminate information to our businesses, call in or write into the county supervisor meeting. I did listen to most of it. And other ways to try and get or see about this, getting the supervisors to overturn the restaurant mandate starting tonight at 10 p.m. To many, this 10 p.m. time means they will stay closed for the next 3 weeks or more, because I'm pretty sure we all know it'll probably last longer. Some will be laying off staff to keep skeleton crews, and some may close sometime between now and the few weeks and never open again, which all this is pretty sad happening at usually the best time for a business during a calendar year. So what do we do? I guess that's what we're here to talk about tonight. We would like to thank Supervisor Barger and Hahn for trying their best to overturn this change. But at the same time, I respect Supervisor Solis, Kuhl, and Freely Thomas that did not. This pandemic's bad, it's dangerous, science is there, but our businesses seem to have been the ones paying for it. You know, not to forget to mention our healthcare professionals, nurses, doctors, and first responders. The Glendora Chamber will continue to work to do what we can to help our business community, but without everyone's help trying to get past this, a lot of the work we're all doing is basically meaningless. You know, now, are the businesses the cause of all this? No, we all know that. But I ask, what else can be controlled, right? You know, we keep hearing about it. We do more tests. Well, because we're doing more tests, the numbers are so high. But I like to respond, if a pregnant woman doesn't get a pregnancy test, is she any less pregnant? I mean, tests aren't making the case. It's just showing us we have a problem. So I just remind people, even though with all this stuff going on, to support our businesses, and we'll get through this in one way or another. And I remind you, when we all need to buy something, think for a sec. I know it's real easy to push a couple buttons on with those big guys apps, and it's at your door in 30 seconds. But remember, they don't really give a rat's ass about Glendora, excuse my French. So maybe just stop and think for a second. Let's think locally, and that decision may make a difference. Thank you very much, and happy Thanksgiving.
Thank you, Joe. I don't see any other hands raised. Kathleen, do we receive any other public comment that did not make it to the city council that can be read?
Yes, actually, at this point, I'd like to read 3 correspondence read into the record. The first is from Joan Bristow. Please do not close our restaurants. COVID is not being transmitted from sitting down at restaurants. Please look at the facts. Also, restaurant closures are a sure way to kill business and make people unemployed. Do not allow the restaurants to close. It harms everybody. Thank you for listening. A patron of Pepper Tree, Glendora, Joan Bistro. The next correspondence we received was from Russ Rotuno. Hello all, I'm writing this in support of our city of Glendora to please keep our restaurants open for dining. The mandate is unfounded and ridiculous. Can we use common sense here? Unlike our state, we live near Pepper Tree and have supported this establishment along with Legends, Angelo's, and others. They are all following the rules and we need to support them. Please keep our local businesses afloat, please. My family and I have lived in Glendora for over 25 years and enjoy eating out. And the last response public comment we've received is from Trina Michalk. And to the City of Glendora City Council and the Los Angeles County Health Department. This may not make it in as I'm in another time zone. However, I feel the need to share that where I am currently, I'm actually free to choose whether I enter a restaurant, dine there, wear a mask, walk down the street anytime I wish without anyone telling me when I can or cannot. It's a neat concept called freedom. You remember it, pre-C word. This shutdown and the following of the tyrant's rules is effectively killing off our small businesses one by one. I have been affected since March, as have many. This new BS political move, and that is what this is, will finish off many small businesses, period. People will lose their homes, cars, etc. It's not okay. I will never stay home, be in by 10 a.m. No, my 90-year mama can't make me do that. Will the county schedule our showers and potty breaks as well? Pretty sure they will try. Good luck. BC, many of us are done. If anyone forgot, this is America. We are not communist yet. I'm absolutely for restaurants staying open and staying open. Does anyone actually research these positive deadly tests? Doubtful. It's morphed into a cold, 2 a flu, vanished, 3 TB is deadlier, but question mark, question mark, question mark. Anyways, keep it up and we will all be in tents in the South Hills, BC. Not one of us will have a job left. Oh, so it's my birthday today. Guess what I got for my birthday last Thanksgiving? COVID. Yep, last year, post-travel, as the sick, drooling lady next to us on the plane shared, my point is I have pre-existing autoimmune lungs and other issues. I am here, yay. This bug, as stated previously, has morphed into a cold and is being politically hung over us. Wow, right before Thanksgiving, and oh, Christmas is around the corner. Think these restaurant owners will have the money for their kids? No. I lived in Glendora for 29 years. I'm appalled that the city council would even consider obeying the suggestion. Again, I live in America, so I shall.
Do I call time on the city clerk?
Thank you.
Yes, you should.
That's what you're supposed to do. And no other comments have been received, Mayor Alouis.
And I see no other raised hands, so I will close the public comment period. And just for those that are listening and want to listen in on the rest of the conversation, we will be going into closed session, and then we will be coming back out into open session to have a discussion of a path forward and more information. So at this point, I'm going to request the city attorney to read us into closed session, and by reading the title into the record.
Thank you, Mr. Mayor, members of the council, ladies and gentlemen participating in this meeting virtually. The city council will meet in closed session pursuant to the authority cited in the order calling this special meeting because there is a significant exposure to litigation in one case. Thank you, Mr. Mayor.
So I see that we have 2 other raised hands. For those folks with the raised hands, I may open up public comment again when we come back into open session. So it looks like there's some other folks that want to leave a comment. So with that, we're going to convene into closed session at 6:45 p.m. Let's see, do we- Yes, we're all here. So I'm going to reconvene the meeting back into open session at 7:39 PM. And all council members are here and present. We request the city attorney to announce any reportable actions out of closed session.
Thank you, Mr. Mayor, members of the council, and ladies and gentlemen who may be participating in this meeting virtually. The city council met in closed session with its legal counsel to provide a privileged and confidential briefing on facts and circumstances which could give rise to an exposure to litigation in one case. We provided a privileged and confidential briefing. Certain staff members were invited to be present as a part of that briefing, including the chief of police. Questions were asked and answered. No reportable action was taken. Thank you, Mr. Mayor.
Thank you, Bill. This brings us to our unfinished business, item 2, an update for the County of Los Angeles Department of Health. I'd like to invite our city manager, Adam Raymond, to present. And after the presentation of Adam and our chief and also the CEO of the chamber, I will open up public comment for those who didn't have an opportunity before to speak. Adam?
Good evening, Mayor, City Council. I know many in our community are watching, especially those involved with their businesses. I noticed that a Catherine staff is on the call, Mayor. Would you like to take him first?
Absolutely. Absolutely.
I think Corey is on, if that is correct.
Correct. I'm unmuting him right now.
Thank you, Kathleen. Corey, you with us?
Hi there. How are you? Can you hear me?
Yes, we
Well,
can hear you.
We're here in a special meeting, so I don't know.
Well, I'm still recovering from yesterday's regularly scheduled board meeting where a lot of this turmoil took place. So I'm right there with you. And so is the supervisor. Thank you again for having us and inviting us to participate. Thank you for your partnership. I know the supervisor has, since her time in the county has started, has always felt at home in Glendora. Knows that she's with people that think like her and take the same pragmatic, rational view of public service. So I appreciate you guys inviting us to be here. As I'm sure has been mentioned and everyone was aware, yesterday the Board of Supervisors voted to approve the Department of Public Health's movement to close down all outdoor dining at restaurants beginning in about 2 hours and 20 minutes. So if anyone's got any last minute urges to go out to eat, they've got about 2 hours to do so. That's going to be a 3-week closure. That's at least what it is scheduled for. Supervisor Barger was adamantly opposed to this. She brought forward the motion to cancel this order, and it did not pass. It failed 3-2. This is very frustrating for the supervisor, given that the Department of Public Health is unable to provide concrete data tracing increased transmission back to dining at restaurants. There was a lot of, well, we think it's there, we think it's happening there. It was a lot of hunches, and from our standpoint, if you're going to shut down an entire industry that employs 700,000 people in the county of Los Angeles, you better have more certainty than we think it's happening there. And that was the supervisor's point. She made that very clear. She's been all over the news saying so, and it's been very frustrating for our office to see that happen. So if we're going to be monitoring this day by day, I know the motion said it was going to be for a 3-week closure of restaurants. We'll be monitoring this consistently, and at any point we see where we can overturn this, given the cases begin to trend the opposite direction, we will be acting on it. So we will not be waiting through weeks. We'll be pushing throughout this 3 weeks to get these restaurants back open as we go through Thanksgiving and into the holiday season. The other looming directive, as was announced by the county about a week and a half ago, is that if cases were to cross an average of 4,500 per day in LA County, then we would enter into another safer at home. The big distinction, which I want to emphasize, is that in March, when we first went into safer at home, that was a full lockdown. That was everything's closed. you can literally only leave your house if you're doing grocery shopping, work at your grocery store, or an essential worker, or going out for a walk. That was done out of an abundance of precaution, of not knowing what transmission looked like. Now we know a lot more, and this Safer at Home is a lot more targeted. It will not be closing all retail. It will be slightly reducing capacity restrictions at retail, but it will not be closing essential or non-essential retail. Most things that are currently allowed to operate will be allowed to operate either outdoors or indoors if that's what's required. Schools will not be closed. Private gatherings are currently capped at 15 people and no more than 3 households. Those will be limited, confined to just one family. At this point, the supervisor is pushing for the board to take no additional action, given that we just closed down restaurants, and Public Health has consistently said we need to wait a few weeks before we do anything, and that's what we're pushing for. So right now, nothing has been announced, but that if you hear a Safer at Home order announced, it is not the closure of everything. Retail is not being shut down. And I want to just make sure that is clearly understood, because I know that can be confusing using the language Safer at Home again. The other thing the supervisor did yesterday in response to the other supervisors wishing to close restaurants, she redirected some of the CARES Act funding that was in play, about $10 million of it, to be redirected towards restaurants, breweries, and wineries as in a grant program to those that had not yet received funding and support. Her feeling was, if we at the board are going to close something, we should provide whatever support we can. We're obviously pushing for some sort of federal relief that will be a more robust support package, but at this point, that's not out there. So CARES Act funding was allocated, and there will be information on how restaurants, breweries, and wineries can apply for and receive that funding in the coming weeks.
Corey, so I'm going to stop you right there, since that's there, and we got a number of people listening. If they already have PPP loans before, can they not, or they would not be qualified for this?
This is separate from that. So this is going to be from the county was delegated CARES Act funding that we can utilize to support recovery from the pandemic. This is allocated to us at our discretion. We have allocated it to many industries, to schools, to other businesses that needed support or were closed, and this is being allocated in a grant program. So it is separate from the PPP.
So the restaurants that are listening right now to what's going on, they can apply for this even if they've gotten PPP before.
Yes, that's my understanding. It's completely separated from the PPP. The PPP was a federal program that was run through federal funding. This is a county specific. We're just doing support for our local businesses.
When will that be available?
It takes a couple weeks to get off the ground, but I will make sure we get that information exactly back to you.
That would have been nice if they did this beforehand, so it would dovetail with the closure.
I know we were not expecting the closure to go into place, and so we had to kind of respond really quickly. And it was a let's secure the funding and figure out the details later situation, make sure the funding doesn't go another direction. So that's I completely agree with you. If we had known that the closure was going to happen this week, we would have had this lined up, weeks ago. Unfortunately, Public Health and some of the other board offices moved a lot quicker to get things closed, and we were pushing very hard to make sure that didn't happen, unfortunately.
Well, please continue with your presentation.
So those are the two big things that I wanted to make sure I touched on. And again, this is a very fluid situation, obviously, as we've learned over the last couple of weeks, and things move very quickly. We're the only county in California that's closed outdoor dining. And obviously, our view is we didn't win the vote, but we think the public perception and the public opinion about this decision is pretty clear that it's not supported. Even the LA City Council voted 11-3 to keep restaurants open. The city of Pasadena, who has their own health department, is going to be keeping their restaurants open because they have their own autonomy there because of their own health department. We've already received letters from dozens of cities in the county saying we need to reopen these businesses. They're essential to our community. So,
Corey, is that correct? The supervisors meeting yesterday, because I was on there trying to get on public comment for an hour and a half and didn't make it. There were over 7,000 letters of support for Catherine and Janice Hahn.
There were over 7,000 total public comments. There was over 3,700 letters of support of the supervisor's motion of keeping restaurants open. I think like 30 opposed to it. So it was an overwhelming, it was a flood of people coming out and pushing to support it. It was not even close.
What I felt was disturbing a little bit when you called in, they asked if you're in support of this measure or not, which was challenging because this was not a hearing.
Correct. So because it happened, the closure happened at the last minute, so we weren't able to file this motion the Friday beforehand to make it a normal agenda item. So we have a set item every week, our first set item, which is just to discuss the health officer order. And so we had to read it in under a special condition, which made it confusing on the call-in front. So it's understood. We understand it wasn't clear. It was our only way of bringing this motion forward to get it tabled yesterday and potentially to have action on it immediately.
Thank you.
Understand that though. But that was I wanted to, keep me talking, on what I think you guys want to hear about very short. But I'm happy to answer any additional questions or clarify anything. I know that it's a fluid situation with a lot of details that even I sometimes don't understand. So I'm happy to further explain anything.
Well, I want to ask you one other question. I'm going to let the rest of my colleagues ask some questions if they choose to. The 35% occupancy rate for the essential and the 25% non-essential, any idea when that might hit?
I mean, so technically the board agreed that would go into effect as soon as we averaged 4,500 cases per day. We already crossed that threshold, but the supervisor made it clear that she does not want that to go into effect until the board's able to discuss it again. And she is pushing that to delay that as much as possible. I think right now, given how much opposition there was to closing restaurants, I don't think the board has the stomach to implement that at this exact time. It has not been proposed. Timing has not been proposed, and I don't think it's going to happen immediately.
And Corey, just as a heads up, as we understand it this afternoon, talking with Barbara Ferrer, that we'll get 72 hours notice prior to official action with subsequent approval of the board. So we believe it's probably going to come up at your next board meeting.
Yeah, we're planning to discuss it on Tuesday, or that's the plan, is to discuss this upcoming Tuesday. I mean, my hope, the reality is we saw a 40% increase in testing this past week over the previous week. It's our understanding that it was because everybody got tested so they could go to a Thanksgiving gathering with family and just wanted to take that extra precaution. It was a statistically significant change, and that's what led to this serious increase in total cases. Our positivity rate did not spike as significantly as the total cases did. So our hope is that cases will trickle back down over the next couple of days, and there'll be less pressure to implement this.
I'll bring this to council. Does anyone wish to ask Corey any questions?
I have one.
David?
Corey, thank you. And the County CARES Act opportunity is encouraging, but I struggle when I see our state and federal legislators bragging about putting all this money out, but making it completely unattainable and unreachable for the normal business person. So I'm hoping you can offer some encouragement that you did say that there will not be the restrictions, but is this money actually attainable by the average business person?
Yeah, so we did a similar program when we got a previous tranche of CARES Act funding a couple months ago, and it was my understanding that it's an application process, but there's not a lot of barriers to it. It was much more accessible, very few hoops to jump in compared to the federal and state funding. And at least when we implemented it last time, there was very little pushback from the communities and from businesses about how difficult it was to access. I'm sorry.
Thank you. That is encouraging. Thank you. No more questions.
Anyone else?
Yeah, Michael, if I could.
Go ahead, Gary.
Corey, I'm curious, could you share with us briefly how these decisions are made by the health director? I mean, does she have a board or a committee of advisors that meet and advise her on what to do? Is this just information that she's gathering on her own? It's a bit of a mystery as to how we're coming to some of these decisions. I was wondering if you could share that with us.
Well, I'm trying to be a detective on that same subject. So how it works, it's frustrating. The county is not structured, especially the Department of Public Health, for an emergency like this. So if you were to set up an organization to manage this kind of a response, this isn't how you'd structure it. So how the health officer who is his name's Dr. Davis. He works directly for Dr. Ferrer. He's our second in command. He and Dr. Ferrer have the authority in a health emergency to execute these health officer orders, at which we've kind of all been living under the mercy under over the last 8 months or so. And they have autonomy. It's given to them by the state to implement these on their own authority. So Dr. Ferrer has consulted the Board of Supervisors on these, asked their opinion, gotten feedback. The board has given feedback and directed yes or no. Occasionally, we have written motions to tell them what to put into their health officer order. But at the end of the day, they have the authority to act when what they see fit. Now, Dr. Ferrer has a team of epidemiologists underneath her that have a wide range of specialties that she relies on for feedback. But at the end of the day, she has the authority to act independently of the board, but does go to the board for approval because of the obvious power structure there. But on top of that, another motion that we brought in, that I brought in, or the supervisor brought in yesterday, which what was a little less dramatic, was to work with local universities to provide public health experts and to bring their expertise to the table to consult directly to the board on their feedback on alternative plans for responding to this public health crisis. And the supervisors made it a commitment to bring in voices on every aspect of this entire pandemic, whether it's business, education, mental health, bring them all to the table. We felt it was appropriate to complement the perspective of the Department of Public Health with outside experts that have done a lot of creative research into this to hopefully come to some more robust and sustainable solutions. So we are diversifying the portfolio of feedback at which the board is listening to at the same time.
Okay, appreciate that explanation. That's all, Michael. Thank you.
Anyone else?
Mayor, I see Mendel's hand raised.
Mendel?
You're on mute, Mendel.
You're still on mute, Mendel.
I just sent him a request to unmute.
There you
I'm
go.
sorry.
All right.
Okay, sorry. Corey, so next week the board meets on Tuesday. Is that what you're saying?
Yes, and so we don't have a
Okay.
regularly, it's an every other week meeting, but we will discuss the health officer order next Tuesday. Yeah.
Okay. And then I'm curious about what you just said. So it sounds like that the board does not have the authority to override the county health official. So if yesterday, so if the vote had been 3-2 not to shut down outside dining, could they have gone ahead and shut down outside dining?
So the health officer has the authority to implement, like any county department, they have full autonomy over their area and can do whatever they want to. But if the board brings forth a motion directing them to do anything, they have to follow it.
Okay.
So there have been situations in the past where the health officer has disagreed with the board, and the board brought the example being breweries and wineries that we reopened, 2 months
Okay.
ago now. Health department did not agree. The board brought forward a motion and directed them to do it.
Okay. Thank you.
Aaron, did you have anything you wanted to ask or add?
No, thanks.
Thank you. So I have to give my apologies. I've been calling you by your last name and not your first name, Andrews.
Well, as a product of the public school system, I went by Corey many years of my life. And in California, I went by Andres for many years of my life also. So
Hey, I'm Adam Raymond, so I feel you on that one.
Adam, did you have any questions you want to ask?
I just actually wanted to say thank you. I see Sandra's on the call too. And so I know both of you at the very last minute, we reached out when we got the request to schedule the special meeting, and we understand the supervisor and her position and fighting for, our community, and she's our supervisor. So we appreciate you making time. We know tomorrow's Thanksgiving. I'm sure you have other places to be, but we appreciate you spending the time here this evening.
No, appreciate you inviting me and appreciate the severity of the situation at which this council is taking it. This is a fluid situation, and The supervisor's not done fighting for this yet. We're not rolling over. We think that the public is on our side on this one, and that was made pretty clear. When the LA Times is writing an editorial that's favorable to our position, we know we might be onto something.
Yeah.
Well, Andrews, with that, I really appreciate and thank you for your courage for coming on, because you didn't know what kind of a council you were going to have. I also want to for you to pass on our thanks to Noelle Barakat. She's been on our EOC meetings and she does an amazing job. She's a great asset to not only us, but our schools and our businesses. She's out there helping quite a bit whenever asked. And so I like to pass our regards and thanks off to her as well. But thank you again for coming. I know you have a busy evening and you have other things to go and do. We really appreciate you helping and answering questions so eloquently.
Well, I appreciate you guys for having me on and for always letting the supervisor's office come and present and for welcoming me in Sandra. So thank you all. Please call anytime you know where to reach us. And we appreciate your support of our local communities, businesses, schools, etc.
Absolutely. Have a happy Thanksgiving.
Thank you. Happy Thanksgiving, everybody.
Mm-hmm. Adam, you want to continue?
Yeah, let's do it. Next slide, please. So every city council meeting, we provide this update to the council. There's a lot of other people on the call. We wanted to give some background. We appreciate supervisor's office coming out. We know they're limited on time, so some of the information may be duplicative and we will get through it quickly. But from April 28th through our last city council meeting on November 10th, we've provided 11 COVID updates to the community. The city council and staff have really tried to provide as much information and clarity to the entire community as possible in these times. Past presentations, if you go back and look at them, are pretty robust and have a lot of details, which help us get to where we're at now. In similar fashion, this update is a update from our last city council meeting, which is, as you will note, a lot has happened. Next slide, please. So some acknowledgements before we begin the presentation this evening. Our goal is absolutely to provide as clear information as possible from a staff perspective, not taking sides one way or the other in the argument, but trying to ask the right questions and try to point out some of the facts as we know them. And just for our community, we have said it before, many of the council members, if not all of them, have acknowledged that we have asked our citizens for some unimaginable sacrifices. Unfortunately, a lot of the time from a government perspective, from the feds all the way down, we've failed in our ability to be able to provide the right sort of funding to meet those sacrifices. We have not done a good job. Not that a lot of people haven't tried, it's just not been there. You know, and as we have this discussion, decisions between health, safety, and economics are always difficult. And I think it's really important to not discount the COVID fatigue. I mean, we've heard about it now for so long. We're 10 months and having these conversations at City Council. It is a lot. And in sort of 2020, you know, has been a year of loss for many people, loss of jobs, loss of security and loved ones. And so we just understand and appreciate everyone tuning in tonight to hear our conversation. And we hear you, we understand, and we're doing everything we can. Next slide, please. We're going to get through the vaccine area quickly, try to provide some clarity. State of California is one of 5 jurisdictions in the United States working directly with the CDC. Their scientific review panel has studied phases 1 and 2 from both Moderna and Pfizer, and they are waiting to review the phase 3 data. So far, they've not seen any issues in moving a vaccine through quickly in California. Next slide, please. There's various working groups that the state has. They are putting those guidelines in who will receive what vaccine first if you're eligible to receive it. That will be available on the state's website here very quickly. Healthcare workers, first responders, and those in congregate care facilities will be the first to receive a vaccine. The state is also working to procure the ultra cold freezers for distribution of the Pfizer vaccine. Next slide, please. And finally, the state's working, we anticipate them to issue a contract with an IT firm to be executed to help with the tracking of the vaccine. And it should be noted that the feds work directly with the state then works with the county, and that is how the vaccines will roll out in the state of California when they're available. Next slide, please. State currently operates under something called the Blueprint for a Safer Economy, which was adopted on August 31st, provides a 3-week minimum to transition between various stages. LA County, the earliest we could reach the most lenient stage is 2021, early 2021. Statistics are updated every Tuesday. And it's noted here that the last stage is not a full return to normal. Next slide, please. On November 16th, the state pulled what's referred to as their emergency brake. There is a color coordinated system with each tier. Purple tier is the most restrictive. With that emergency brake pulled, which is in effect from 11, basically November 21st through December 21st, they moved 94% of the population in the state of California back to the purple tier, excuse me. All non-essential activities must stop between 10 p.m. and 5 p.m. according to the state order. And this emergency brake allows the state not to stick with its standard weekly updates, but to add new rules whenever necessary. While other surrounding counties 2 weeks ago were in different tiers around us, now Los Angeles, Orange, Ventura, San Bernardino, San Diego, Riverside, and others are all in the purple tier. Next slide, please. State of California has also issued a travel advisory for non-essential travel, asking people to quarantine if they come in and out of the state or internationally, and only mix with people in their immediate households. And the state is encouraging Californians to stay home or at their region and avoid non-essential travel. Next slide, please. So part of the reason why the state gave its methodology for pulling the emergency brake is their 7-day case average is now at 12,000, which is more than double where they were 21 days ago. They've seen an 81% increase in hospitalizations, 57% increase in ICU admissions. State reported this week that 175 hospitals have ICUs that are already under significant pressure and have requested state assistance. And the infection rate from the state level, as said, has increased significantly, which is attributed to gatherings outside of the household, essentially private gatherings at your house. Next slide, please. So here is the county risk level and tiers. For those of you who have tuned in before, you have seen this. There are 3 metrics in which the state measures all cities on. One is the adjusted case rate per day. The second is the positivity rate. The positivity rate has 2 factors. One is the actual positivity rate, and the other one is aimed at the lowest 25 quartile of various populations in your community that are most at risk. Next slide, please. Los Angeles County currently in the purple tier. Adjusted case rate per day is 16. We were previously at a low of 7. There is varying methodology for why we were at this rate. More people being tested for the holidays, increased testing that's happening. Overall, our positivity rate, it says here at the state 6.6. We heard today is 7.4. That does not, while that is double, it doesn't represent a significant jump as the new cases per day. They're not equal to each other. And the state no longer is producing the health equity quartile positivity rate for those most at-risk populations. Next slide, please. So what does that mean for us? I think it's important to note that the state, we'll talk about it in a little more detail, sets the ceiling on allowances, and the county can set the floor. So the Safer at Home, the county health order was amended on May 29th for Safer at Work in the community. That is May 29th of 2020. On November 17th, and this is where if we keep track of dates, it gets confusing because the information's out there confusing. We will do our best to try to simplify this. On November 17th, or 8 days ago, the county modified the health order effective November 20th. All of what we're going to talk about here is currently in effect. Non-essential businesses are permitted to operate indoors. Occupancy is limited to 25% maximum capacity in certain cases for non-essential businesses. The number of people at patrons and outdoor restaurants, breweries, and wineries will be limited to 50% of max outdoor capacity. With the understanding that this changes at 10 p.m. this evening, according to the county, I think it's important to note that this decision was made 8 days ago. it was effective 5 days ago. We haven't had the chance to see what the impacts of this rule were because of the next part of the health order that's amending. Next slide, please. Additionally, effective on the 20th, basically limited the capacity in certain areas like card rooms, outdoor mini golf, batting cages, and services of personal care establishments. Essentially, you must wear a face mask, you must make an appointment, and if you can't do either of those two things, those businesses may not operate. Next slide, please. And there was also the provision of restaurants and breweries closing from 10 p.m. to 5 a.m., which is consistent with the state order. And then outdoor gatherings must only include 15 people, no more than 15 from 3 different households. This is still the rule in which we operate on. Next slide, please. So one day after they announced that health order, the County of Los Angeles produced a November 18th criteria that talks about averages in cases. At that time, this is after a board meeting, the County Board of Supervisors discussed with the increasing case rates that they wanted to set some barriers, which additional restrictions would fall into place. So here's where the timeline gets a little difficult. The county came up with a rule that said if the 5-day average of cases exceeds 4,000 per day on average, or hospitalizations reached more than 1,750 per day, that outdoor and indoor dining at restaurants, breweries, wineries would be prohibited. The county projection was at the current rate that they would hit that on December 6th. Well, the county hit that number on November 22nd, 4 days after the issuance of those guidelines. This is the rule that's effective at 10 p.m. this evening, and it stays into effect pursuant to the health order for 3 weeks. The health order, for those who, if you want to see it, is actually attached to the agenda if you go online. It was issued late this afternoon, and we didn't do it at the posting, but it is on there now. Next slide, please. So, talk a little bit about outdoor dining that's banned effective at 10 p.m. this evening. We heard from Supervisor Barger's office about the 3-2 vote that failed to pass to overturn the outdoor dining ban. The California Restaurant Association also tried to sue Los Angeles County. They asked for a restraining order and were denied. The county cited during the meeting a recent CDC study, and that outdoor dining remains the highest risk of any allowable activities because of unmasked people from various households are allowed to sit together over a period of time. And they also cited that the ability to continue takeout doesn't cease operations. Next slide, please. As we look at some of the confusion that exists from this point forward with outdoor dining, the city of Pasadena, which has its own health department, is one of 4 cities in the state of California that does. The city of Berkeley, the city of Long Beach, and the city of Los Angeles are the other 3. Decided they were not going to ban outdoor dining, they were going to allow it. Long Beach, however, will follow the county's stance of banning outdoor dining, but no other county in the purple tier has banned outdoor dining. So for those cities in Los Angeles County that border San Bernardino County, border Ventura, border Orange County, you can go across and eat outside, which creates an even greater economic impact to those businesses. Also discussed during the meeting was the lack of official documentation as to how many rates of infection actually exist at outdoor dining. And it was pointed out to the fact that most, based on contract tracing for existing case rates, are happening in private gatherings. About 50% of total infections can be traced back. Next slide, please. Wanted for a minute to take it to educate everyone this evening on what the county also discussed on November 18th. On November 18th, the county set a second benchmark. Flanders talked a little bit about this, but they said, hey, if after 4,000 cases, we continue to see rising totals or hospitalizations go up incredibly high, we'll set a secondary sort of line in the sand that's 4,500 cases a day. This is what the county said would would reinstitute a safer at home order, although modified. It would also be for 3 weeks and would basically mandate 10 p.m. to 5 a.m. curfew for everyone except for essential workers. The county actually hit this case rate on November 23rd. So one day after we hit the case rate for outdoor dining, the county hit also the 4,500 case rate for this. However, these changes, which we will discuss next, there is no effective date. The county has not actually amended the health order to implement these. The discussion we heard earlier about the outcry, I think, goes a long way, but we wanted to provide everyone with an update of what could be coming. Next slide, please. So the recommended changes at that time that were discussed at the county board meeting and again this afternoon with the County Department of Public Health. If the county pulls the trigger on the recommendations, all public and private gatherings outside the home would be prohibited, except outdoor religious services and protests, which in both of those cases would require masking and distancing. Permitted activity for activities outdoors would be 50% capacity. And by the way, every outdoor activity would require certain infection protocols, even within the household, including masking and other related non-touching of playgrounds, for example. All non-essential retail indoors would be reduced to 25%. Essential retail indoors would be down to 35%. Beaches, trails, and parks this time around would remain open, however, would only allow for household groups. And then again, the capacities must be set. Next slide, please. Shared outdoor facilities remain open for members of a single household in this case. Pools are closed with the exception of lap swimming would be allowed. Youth sports would remain to be able to open, but only for conditioning. Libraries would be allowed to be open at 20% maximum capacity, which is new. Non-essential office space would be closed. Playgrounds, except for childcare and schools, would be closed. Bars, clubs, lounges, and sporting events would be closed. Next slide, please. So what we just talked about, although the county hit the prescribed limits, are not in place. And I think going back through those tells an important story where the two trip lines are fundamentally different. One was outdoor closing of dining, and then the next one was a safer at home order. Those are two drastically different orders, and I think some of the confusion comes in that we hit those thresholds on back-to-back days. And in one case, the county moved forward with the restrictions on outdoor dining, and in the second case, they have not implemented what they said they were going to do. Next slide, please. Actually, can you go back? I apologize. Thank you. So the County of Los Angeles, similar to the state, has also issued some guidance. They are asking you to celebrate Thanksgiving with only your household. And similar to other holiday guidance that we've shared that the county has issued, essentially asking for no gatherings, online activities, drive-by, and decorating your home. Next slide, please. So why is the county making this decision, including outdoor dining at this point? These figures are as of yesterday. They have currently, the number says 1,575. They're at 1,680, I think, today of people with COVID-19 currently hospitalized in Los Angeles County. 26% of those are in the ICU. This represents a 75% increase in the past 3 weeks. The county pointed out today, and it's not on here, I apologize. According to Dr. Barbara Ferrer, these figures, the updated figures I just mentioned, represent about 70 to 72% of all hospital beds non-surge related. One of the challenges the hospitals are having is that the number one infection for COVID-19 in terms of professions is healthcare workers. So as hospitals increase, the ability to find staff to further operate those is declining, which is sort of the double whammy from the data that the County Department of Public Health released today. They gave us figures from October 31st through November 13th, which is still missing 2 weeks. During that time, the average daily case rate has increased more than 108%. They mentioned that outbreaks in food facilities have increased over 200, but they did not specify how this is broken down. We do know some food processing factories have had very large outbreaks. But this also includes restaurants, bottling plants, and grocery stores. So we don't have the specifics. This is the most detailed information the county's provided us on this front. Next slide, please. County also mentioned that based on those statistics, there's been a 67% general increase in outbreaks on work sites from warehouse facilities, essential workplaces. And that there is an estimated that 50% based on contract tracing of people testing positive attended a gathering outside of their household at a private event. Next slide, please. So we've heard about this before, and I think it's really, really important that we are very clear here. The city of Glentora must follow the county of Los Angeles. We said earlier, the state sets the ceiling, the county sets the floor, the city can set the basement on allowable activities. The governor issued an executive order that provides this authority that was mentioned earlier to the county to make the rules that people in Glendora must follow. While the city has the ability to set additional restrictions, to date, the city has not done so. Next slide, please. I wanted to remind this group on advocacy efforts. So previously, the city council has requested both federal, state, and county officials and urged them to have a flexible and equitable state and federal and state assistance, allowing cities to address unique community needs. We have advocated for flexible and localized economic recovery allowances. This is largely, Los Angeles County represents 25% of the people in the state of California. The city of Glendora is far different from other cities closer to downtown LA in terms of our layout and in terms of potential for infection protocol implementations at local establishments. Our goal was aimed to assist in revitalizing our economic health while simultaneously maintaining and preserving the health and safety of our community. City Council has also directed staff to advocate for rules that are created and implemented that acknowledge that necessary sacrifices need to be balanced by a clear and concise path forward. Going back and forth with the timeline of events and the health orders and what could be coming and what is and what, you know, when the effective dates are, I think everyone is arguing is not a clear and concise path forward. It is difficult to understand. And if there's any questions on that front, we'd be happy to provide that detail. Next slide, please. And with this, Chief Egan, if you wouldn't mind coming forward, one of the things we really wanted to talk about was enforcement and the city's role and how it has been since the start of the COVID pandemic. Chief, if you wouldn't mind walking through what we do as a city and how we try to work with everyone.
Absolutely. Thank you, sir. Mayor and council, public watching online, Chief Egan here. Quick reminder that our plan and approach has not changed since the onset of the pandemic and the initiative which we began as a wide sweeping law enforcement function across all of LA County. We have all taken the approach of educating the public, educating restaurants, businesses that are in violation, hair and nail salons, individuals, and lots of different entities. Again, that approach has not changed, even though we're under a new health order condition. We will continue to accept complaints from the public. We will log those complaints. We'll handle priority calls for service and other criminal nature calls first and foremost. But at a certain point, we will address the community complaints regarding a health department violation. Those are the chances and the opportunities for us to interact with those people and offer an education resource. We'll provide them a current copy of the health department order as well as a City of Glendora letter. And our goal is to get people to regulate themselves and so that we have voluntary compliance. To date, we have only cited one location, and that was the large party house on Sierra Madre several months back. We have probably a dozen, plus or minus 2 or 3 businesses, gyms, various locations in town, which have received several complaints back to back. And we we investigate those complaints and document what we see and make those referrals to the health department. The health department has environmental protection officers that will come out as part of their normal practice and take our findings and talk with the owners. And their goal is the same as ours, which is to get those businesses into compliance. If they fail to comply, or there is an egregious violation, or we have repeated offenses, then they can and they will cite that business for the health department violation. Other chances we have in contacting community members and other calls for service where we find that people are in violation of that health department order. And that is our opportunity to engage those people in an education campaign. It's not meant to be punitive. The goal here is not to seek financial gain in citing people and issuing these citations. The goal is that we get everybody on board, get them educated with the conditions of the health department order. No matter how we feel about it, we take what the order says and we apply it across the city of Glendora, and get people on board with regulating themselves and becoming compliant. And I'm happy to answer any questions you might have, Adam.
Perfect, Chief. Once we get through the rest of the meeting, I'm sure, this item after public comment, I'm sure council will have some questions. Just wanted to reiterate for the group that definitely we've taken the education approach. We go out there, and I know Joe's on the call, and I'll turn it over to him in a little bit in case he has any other questions or comments for everyone outside of his comments in the first part of public comment. But we work with Joe and the businesses. Our goal absolutely is not to tell people how to be adults. We try to allow everyone to be the adult, to make the decisions on their own. And if needed, we do respond and try to educate first and foremost. Next slide, please. Never a bad time to remind everyone the city facilities are open Tuesday through Thursday at City Hall, Police Station, Transportation Center. The computer lab is open. The Bidwell Forum outside the plaza area. We have a discovery space where we try to provide some additional library services. Staff is still available at all times via phone, call, video conference, email, Monday through Friday. Next slide, please. Some city website and information. And before we get to the recommendations, Joe, I know you're on the call. Is there anything else that we missed from a business standpoint that you wanted to mention? First and foremost, you do a wonderful job advocating for businesses in the community and keeping us accountable on our end. Wanted to provide you an opportunity to jump in here in case we missed anything, and also plug some of your websites.
Oh, well, thank you. We've been getting those same calls as Chief Egan talked about, and we refer them out to proper people and stuff. One thing I did want to remind council that monies that have been available through the county, like that are going to be coming up soon, a few of those have been gone in about 20 minutes. So and with this, I would guess to say it's going to be pretty quick. So we've been just about every time money is available for business, we'll get it out minutes after it's available. So we'll keep everybody abreast of when that's going to happen, because the money's going to go quick, because there's a lot of restaurants in LA County and several $1 million goes pretty quick. I really don't have anything else other than what I talked about before. We do have our Pride of the Foothills Strong website, which has all these links, plus a lot of other ways for businesses to stay informed, get certified so they know how to do stuff. So, but other than that, I don't really have anything else. Thank you.
Thank you, Joe. Next slide, please. And so with that, Mayor, we asked the council to finish their discussion that we started before this item and provide any direction to staff as necessary. Staff's on the phone to answer any questions, as is Joe. We have Jeff and Valerie, I believe, are on the call as well, if there's a business question, and so are the chief and I. So with that, I turn it back over to you. Thank you very much.
Thank you, Adam. Thank you, Chief. Thank you, Joe. At this point in time, I'm going to reopen public comment for those that didn't get an opportunity to speak before. So I'll invite members of the public to address the City Council on just this one item, obviously. Speakers limited to 3 minutes once. If you'd like to request to speak, select the raise hand icon in Zoom before the close of public comment period, and you'll be called upon to speak. It looks like we have two folks that want to speak. Kathleen, you want to take over?
Sure. David Frisella, I'm going to send you an unmute request. David, can you hear us?
Yes.
Okay.
You see me? I don't think my camera's on, but anyways, I want to first say thank you, City Council, for all your hard work that you've done. We really appreciate it. If you don't know me, I'm David Frisella. This is my wife, Serena Frisella, which I guess the camera's on, but we own Frisella's Roastery in the downtown area, and we've been there for about 12 years now, right? So quite a while. And I just want to again say thank you for all your hard work. And I tell you, it has been an absolute blessing that you guys have allowed us to have extended outdoor dining. I will tell you right now that without having that opportunity today, we will not be open. With about 75 to 80% of our business is our income is from indoor dining, and now currently outside on the street. We're not like an In-N-Out or a Chick-fil-A where we would have a drive-through to kind of keep our business rolling. So a great majority of our income, almost all of it, to sustain our business is dependent on indoor or outdoor dining at this point. So Serena and I are really concerned right now with this new law that limits dining to strictly takeout. To be honest, I don't know how long we're going to be around in the downtown area. As everyone knows, 80% of restaurants fell within the first 5 years. Fortunately, we passed that, but profit margins in restaurants are just so narrow to begin with. And you throw COVID on top of that, since March, and it just really hits you. We were fortunate enough to get a PPP loan, but as time goes by, that money's gone. So now we're just kind of figuring, what the next step is. And I tell you, this is just like a major hit to us. So from a financial standpoint, we will not take out a loan to sustain our business. I don't want to go into more debt than we have right now. So we just take everything, a step per day. So it just makes it difficult. I wish we had known about this earlier, because now we just put up a brand new tent outside, which is costing us, in addition to our $10,000 rent payment, it's an additional $4,000 a month for a tent that we can no longer use. So again, I just wanted to comment on that, and just thank you again for all your hard work, and hopefully we can find some funding to sustain us.
Thank you, David. Our heart and prayers are with you.
Fred Sparling, I'm sending you an unmute request.
Thank you very much. This is Fred Sparling with Classic Coffee in the downtown village. I think every one of you have been in there, so I won't spend much time talking about that, except I really do appreciate you helping us. My question is, if we are doing a takeout business and somebody walks outside and sits on the bench in front, or even at one of our tables out front, is that a violation of the order for no outside dining?
After public comment, I'll ask the question of council.
Thank you.
Is that it, Fred?
Yeah, other than I want to just reemphasize what David said about we really value what the city has done for us. We appreciate you and thank you very, very much.
Thank you, Fred.
Restaurants in other cities, and they're just amazed at what Glendora has done for us compared to what their cities have forced them to do. So thank you very much.
Thank you again.
John
Kathleen?
Harold, I'm sending you an unmute request. You're live.
Thank you. Again, can you hear me?
Yes, we can hear you.
Again, my name is John Harold, and I've been involved in government my entire career. As a matter of fact, recently the County of Los Angeles gave me my clock for 35 years of service. And what my time in government has taught me is that government governs with the consent of the people. When the government loses that consent through losing the trust and the confidence, we're in all trouble. And unfortunately, the city of Glendora has done a wonderful job. I'm very pleased with how quickly you've responded. I am not happy with my employer, the County of Los Angeles, or with the state of California. Neither one of them have done any good for anybody with how they've handled this situation. From things like the governor being caught at an expensive restaurant in the middle of this, to the County of Los Angeles coming out with inconsistent rules and regulations. The problem we're going to have is I'm hearing from people around town that they're not interested in following the law anymore. And I have to explain to them, it's not a law. These are actually orders done administratively. And the problem that we have is people are losing confidence in the health department. People are losing confidence in the County of Los Angeles. Now, what I think needs to be done is this needs to be handled through the courts more. Now, it's reprehensible to me that the Restaurant Association waited till just a few days ago to try to go to court. What I would like to see is the city of Glendora join forces with other cities to go to court, because this type of action should not be going on. The whole point of this from the beginning was to flatten the curve. They told us we had to do certain things to flatten the curve. This has been going on 9 months now. They've not been able to show or justify, I believe, the restrictions that they've put on people. They've asked people to lose their entire professions. They've asked people to lose their careers. We just heard from 2 very good merchants in town, one of which, Priscilla's, is an absolutely wonderful place. But they're not the only one I've noticed. I've noticed other places in town that they have spent a great deal of money complying with the county's rules, complying with the state rules. They worked very hard to put out outside areas. And in a very short time, with very little notice, they were told that that's not good enough anymore. But yet, on the other hand, you have mass protests. There are protests still going outside of the criminal courts building. There are still groups of people massively protesting, and yet nobody complains about them. If there was a super spreader event, my money would be on one of those things. But yet instead you have them picking on restaurants. They pick on the little guy instead of going after the people that they should be going after. Again, like I said, I have no criticism of the city of Glendora. They've done a very good job, but I think we need to up it to a higher level, which is to have our lawyers participate with the other lawyers in the surrounding communities and have them make it very clear to the County of Los Angeles that they are not going to be able to destroy our economies. Because let's be honest, if this continues the way they're doing it, what chance does the downtown area of Glendora have? And again, my wife and I, we've been eating out so much, I've gained weight, trying to help the businesses.
On that note, John, thank you very much. Time's up. Thank you, John.
All right.
Thank you. Do we have anyone else that wishes to speak?
Mayor, I don't see any other requests from the Zoom participants to speak.
So at this point, I will close public comment, and I want to have our city attorney, Bill, answer the question about if you take food from a restaurant and you go to a public place and eat it, is that
actually, Mayor, I'll take that one if you don't mind.
Sure.
So currently, and before we move forward with some of the parklets in the open space, and I base this on what staff's sort of the direction we've already provided to staff internally. And that's as follows. The current health order currently in place that we talked about allows for gatherings of up to 15 people outside, obviously masked and what have you, according to the current health order. Our standpoint beforehand was if people ordered food inside, got it to go and sat outside at a table, that that was allowable, and that's the stance we will continue. The further health order, and a lot of these places obviously are in the right of way, city sidewalk and street. Obviously people would be held accountable for ensuring that they're distancing appropriately. But our stance at this point is that it is acceptable for people to order inside and eat outside where benches are available in the right of way or seats are available. If the county health order outlaws any gathering, then that would be a different story. But those restrictions have not been put into place yet.
Thank you, Adam. So for clarity, out of questions, on our sidewalks where restaurants have tables out there, it's on our property, but they're tables, is that allowed or disallowed?
The first time we went through this process before the parklets, we allowed people to sit at those tables so long as they were together with their families and 6 feet apart.
And they weren't being served?
That is correct.
So if someone goes outside in front of Frizella's and goes and grabs their food inside or however they grab it, and they go out and sit in their tables, that's acceptable?
That is our position, yes.
Thank you. With that, I'm going to bring us back to council for any questions. I'm going to start off with you, Mendel.
Mr. Mayor, thank you. And I really want to thank the citizens that have written in and just spoke. I have a lot to say. I'm not going to say it because Dave and Fred, John, Erica have said it all. And I really appreciate the energy and the support which the citizens have given. I also want to say thank you to the supervisors that have supported a rational choice. Catherine has stood up and been very, very strong, along with Janice Hahn. And I want to say thank you to both of them. It's frankly a embarrassment the three of them didn't. And at 10 o'clock night, it's fair to say that close to 700,000 people that are in the business of serving, cooking, and managing will no longer have work. And that's very, very sad when the logic that they've employed is actually none. We have been doing this for 9 months and they cannot prove that COVID is spread in any sort of measurable way at a restaurant. And for them to vote to close the outside dining down is a derelict of duty in my thinking. We can fly on planes, we can shop at big box stores, and yet in all of those spaces there are more people there than probably will ever be at one of the restaurants that we have. The logic is just not there. It's easy to say no, which they have consistently done, but what are they doing to help us out? I would hope that as the colleagues that I shared the dais with have expressed, that we will send a letter of resistance and urging the supervisors to take another look at what they've done, the harm, destruction that is happening to cities and to businesses and to people's lives. I would hope that they would understand that the data does not support what they are doing. It's just not a logical thing to shut the outside dining down and think that outside groups are not going to grow. And that's where they claim that most of the spreading occurs. Well, then keep the dining as is and minimize the growth of outside groups. So I would hope that the council tonight would seek a resolution to ask the county to reconsider what they've done. I would also ask that the different cogs that are out there take a serious look to collaborate with each other and say, no, this is not a good choice. As Corey said, it's not an accident that LA Times have come out against this. It's not an accident that the LA City Council voted against this. It's not an accident that over 7,000 people wrote and called in and voiced opinions. And I would encourage us, lastly, that on Tuesday of next week, make your voices heard. The supervisors are going to meet again, and we need to make sure that they hear that what they've done, or at least what some of them have done, is not right. And so I am supportive of what I've heard from others. And with that, I'll say thanks.
Well said, Mendel. David?
Yeah, thank you, Mr. Mayor. Thank you, Mendel. Great comments. I think if there's one embracing thought out of this whole thing is we're all on the same page and want the same direction. Without a doubt, there's no dispute. This is a lose-lose for our businesses. Somehow we have to come up with a way to not make them suffer from punitive events. If they were cavalier and decided to say no and go ahead and continue serving and get beat on, if you will, by the county health department, they lose again. So perhaps while we don't like it, the only method we have is to campaign with strong letters, strong alliance with the other governments around us to push back. And Mendel's right. We need to say no, but we cannot do it in a way that runs the risk of the businesses getting trampled by the legalities of it. So we have to support them as a community, but we need to have a strong voice. So we need to stand up and push back. So whatever method we can do that best, I support.
Thank you, David. Gary?
Well, everything has pretty much been said, but, it's important to understand that a lot of what this meeting was about was for us to learn exactly what we can and cannot do. And our hands are tied in a lot of ways. It's important for people to understand that the restaurants are governed by the Los Angeles County Health Department. And so regardless of what we do, if the health department comes in and pulls their health permit, they're not going to be able to operate. So we have to be careful in any decisions we make. I would agree with Mendel and David. I think it's important for us to send a letter to the county supervisors to let them know that we support both Janice Hahn and Catherine Barger's position on this issue. And hopefully we can get one of the other supervisors to change their mind. But the other thing that was brought up, and this is what is most important, my wife actually asked me before we decide to have this meeting tonight, if us making a decision is really going to make a difference. And I told her probably it's not. But what we need is we need other cities in Los Angeles County to step up and make similar decisions. And hopefully if anybody else is watching this from our neighboring cities, reach out to us. If legal means is the way we decide to go, partnering, we can be much stronger than we can be individually. But if we just advocate for the supervisors at this point and for the governor, if we need to, in making some of these decisions, we all agree that this is a serious health crisis, but making the decisions based not on factual information is not acceptable to anybody. And that's what I feel that's being done right now. So that's it. And hopefully we will at least agree to write this letter of support for Catherine and Janice.
Thank you, Gary. Karen?
I would concur that we need to send a letter that asks for reconsideration and some other ways to address the numbers, and also to send letters to the state and to the federal government that they need to step up their game and getting aid and assistance to these businesses. And then also I would just pose a question to the city manager of any other ideas or creative ways that we as a city could expand any of the assistance we're doing that would be within means without making it a gift of public funds, but anything else that we could do to be of assistance.
Oh, way to put me on the spot, huh?
Yes.
8:48 on Thanksgiving Eve. So no, that is actually a great question, and I'm sure one a lot of the people on the call would like to ask. I think, you know, writing the letters and asking for fiscal assistance from the county immediately, you know, in allowing outdoor dining, we have the ability to still let people sit in the right of way and enjoy their meal distance. If the council wanted to have a conversation down the line, if we come back in a week or if something significant happens and we need to reprogram some one-time funding, we would have that ability. But in doing it for one group, we'd have to consider the ramifications in doing it for all others if the issue arose. And we're not saying that businesses are not important, because they are absolutely vital to our economy and our community. It is a larger policy discussion that we would have. The city can definitely continue down the same path we're on, trying to find ways for people to shop at our local restaurants, have dining from our local restaurants, working with the chamber to try to work with other chambers and city city managers to try to come up with a way to get as many restaurants as possible to fill out, you know, requests at the next board meeting, which is next Tuesday. While next Tuesday can be a long time away, I think it is definitely at least our best shot at this point to get some clear direction. And if next Tuesday we receive another hard no from the county, then staff would be happy to come back and look at all additional alternatives at that time.
And, you know, and I want to piggyback on what Josina said. You know, there's a lot of things that are out of our control, but there's a few things that we do have control over, our own behavior. So wear the darn mask already so that we can reduce the impact. That's something that we could do. Next time you wear a mask, wash your hands and distance 6 feet. Think that you're doing it to help a restaurant open up sooner. Because the sooner that we can reverse this, then the sooner that we can get the restaurants open. So if you're not doing it for yourself or your family, do it to help these businesses.
Thank you, Karen. Just to add more information to what's already been said is there's a Mayor's Coalition. We've sent out letters, videos. The city's been great in helping send out some of these pictures that we've had, and actually adding some verbiage and letters to both the federal and state legislature to get us some of the monies. The HEROES Act is, as a matter of fact, one of them. We've also sent letters out to the county and to the state for a better allocation of the CARES Act money, because I believe, Adam, you can correct me if I'm wrong, I think 13 of the largest cities got the lion's share of the money. And you know, our smaller cities didn't get it. They didn't do it by population for the smaller ones. We were disproportionately disadvantaged on that. And so we continue to fight on a regular basis, and we're being heard because there's over 75 mayors that are part of this coalition that have been sending letters out on a regular basis, and even making phone calls and having representatives from the governor's office as well. I actually have some questions that were from the public that I've been getting. Can the city establish its own health department? Adam or Bill?
I believe Bill's on the call. I don't know if he stepped away. There he is.
I'm here. There is a health and safety code. It is Health and Safety Code section 101460, which reads as follows, quote, "Every governing body of a city shall appoint a health officer, except when a city has made other arrangements as specified in this code for the county to exercise the same powers and duties within the system as are conferred upon city health officers by law." We believe that the city of Glendora has entered into such an arrangement with the county of Los Angeles, but arrangements entered into can be unarranged.
Adam, would that be a financial impossibility to do?
Impossible in the here and now, yes. I mean, I think there's a lot of other requirements that go along with it that would just make the situation very difficult. The fact that we're even discussing this very question tells you just the public reaction to what the county did. I mean, the fact that that question is coming up tells you everything you need to know. I believe former Mayor John Harold mentioned that, you know, the people govern, and I think the people are speaking loud. And so financial impossibility in the here and now, yes. And I would just add that just any sort of timing would be a near impossibility too, just trying to get that up and running. But we definitely appreciate the question.
And I would add, given what Adam has learned, the only cities that can afford to manage their department are huge cities. I said we're not aware of any small city the size of Glendora that has help.
Thank you for the lead in on that, because one of our sister cities has put it on their agenda to talk about a regional health department that all cities would in the area would join in, possibly a JPA. Is that something that's even feasible?
In this pandemic, I would say no.
All right. Last question.
And I would just say that just because of none of us are public health experts. None of us understand the situation that would be before us, and trying to set something up, I think the timing of that would be pretty incredible, let alone trying to figure out the funding.
So last question is that if we buck the system, if you will, didn't enforce county rules and laws that's placed before us, are we in violation of the CARES Act and possibly losing the funding that we've received and could receive in the future?
Well, I wouldn't want to discuss anything of a legal nature on this call in open session, but I would just say that the CARES Act funding from the state of California had an expiration deadline in terms of filing and available uses, and the city filed all appropriate paperwork with the state of California. That funding that we received was spent on many activities and benefits the community has seen, and we've definitely complied with any health order that was in place at that time when that money was issued.
So with that, I agree with everything that was said. There are really no words to put to this right now because it's becoming quite emotional. We're attached to our restaurants, the people who run them. We visit them on a regular basis. As Mr. Harold said, that he's gained a few pounds by visiting them to try to keep them afloat, as most of us have. And I think that's admirable of all of our citizens to pitch in and see what they can do. We're family. It's our values. We all try to help each other, want to do whatever we can. This is why this special meeting was put out here, to gather the information that we can, have the council discuss this, try to do a plan forward if we can. Unfortunately, we're extremely limited at what we can do, but we must do something. We just can't sit here. Our residents are expecting us to lead, and that's what we will do. So with that, is there any final comments or any motions that anyone cares? It sounds like there's and folks that want to maybe have a letter going through consensus. Does anyone want to maybe make a motion?
Mayor, if I just may, we heard lots of things. Do you mind if I recap the proposed letters that are on the table at this moment?
Absolutely.
That we would send letters to the county supporting the motion that failed. We would send letters to the COG and other COGs supporting the position that cities join in this effort in Los Angeles County. We would send letters to our state and federal counterparts as well. The letters would include the issues we have with the rationale behind outdoor dining, would encourage immediate funds to back up those restrictions, and to encourage federal and state funding to a larger degree to benefit the larger economy.
Mendel, you look like you're on the edge of your chair.
No, I'm comfortable with that. I guess I would say that we, at least I would not want to pussyfoot around. We need to be direct, intentional, tactical, and data-driven, and point out the fallacy of their ways. When they have to go to court and confess they don't have the data to support a decision based upon the restaurants, that is insane. And we need to point that out to them, not just, and I'm not saying that, you would, but I just, I just want to be very blunt, kind, but blunt, and let them know that hundreds of our citizens are unemployed now because of what they are doing, and make it real, because they don't seem to get it. So that's what I was gonna say.
And not to mention the long-term mental issues that are going to become of this, the families, the children, the financial wherewithal they're going to have to try to figure out how they're going to survive. And with unemployment running out at the end of next month, and the abatement of rental, which will end, what I believe, at the end of January of next year, that they're going to have to start paying back. The stress, the shell game that's being played right now is going to come back to bite and haunt us in a big way in February, unfortunately.
Right.
So do I hear a motion there to direct staff to write a letter to the county supervisors?
I will move that we direct staff to write the letters that Adam mentioned, in as forceful as language as you deem appropriate.
I second.
Or Karen, yeah. Karen, does what Adam said incorporate most or if not all of the previous points that you had earlier made? Because I think you were on a real good roll there.
No, I think I trust Mr. Raymond's expertise and knowledge and the umpteen million hours that he's put into this week alone, not to mention in the last several months. So I trust that he will craft it expertly and cover what needs to be said.
Just for clarity, I would imagine that these letters are independent and not a collage.
Yes, the intention would be a distinct letter. The first letter that would be drafted would be to the county, because time is of the essence. If the council so desires, I'd be happy to work with Joe and get some attachment letters that we could add from firsthand experiences with our local business, if that would be okay with you.
That's fine. I also have a draft outline that I would like to shoot off to Kathleen for just as an outline, some points that obviously we don't have to use, but just encapsulate some of the topics that we talked about this evening.
Sure, if you could please include Christy and Greg and myself on that email, since we're working on a draft. We're setting text as this discussion's happening. So we're trying to, understanding Thanksgiving's tomorrow and a lot of people are off on Friday, obviously. We want to make sure that we're doing everything as fast as we can. And I'd look at Joe. Joe, if you could please send out an email to the business community, and Valerie, if you could do the same with your contacts as well, requesting letters of the impacts of this decision, that would be incredibly helpful.
Yeah, and I think that the caveat to all of this, that especially with all the staff that's on this call, that however you proceed in a way that is respectful of their time and of the holiday, I would not expect them to give up any more of their Thanksgiving to carry this task out. But I think whatever timeline is sufficient. So.
What is your timeline, Adam?
ASAP. I mean, we will definitely have something out to the Board of Supervisors prior to their Tuesday meeting.
All right. So can I have a roll call vote on this?
I have one question, Mr. Mayor. Who's going to sign this letter?
I would imagine it'd be me, the mayor.
Or should all 5 of the council sign it?
That's fine too. That's maybe more important, more powerful.
But you're probably going to have to authorize staff to insert your electronic signatures.
I'm okay with that.
Since this letter is about AP.
That's fine. So do you want to amend your motion, Gary, for all of us to sign?
Sure.
So moved, right?
Yep.
Kathleen, can you take a roll call vote on the letter, please?
Sure, we have a motion by Councilmember Boyer, a second by Mayor Pro Tem Davis. And at this point, I'll ask for Councilmember Thompson's vote.
Yes.
Councilmember Friedendahl,
Yes, absolutely.
Councilmember Boyer,
Yes.
Mayor Pro Tem Davis,
Yes.
and Mayor Alowis.
Yes.
Motion carries 5-0.
Wonderful. Thank you for that. Does anyone have any last comments or remarks before we adjourn?
No, thank you.
Thank
Happy
you, staff.
Yeah, happy Thanksgiving.
Yeah,
everyone.
thanks to everybody for spending your Thanksgiving Eve. This is not what anyone wanted to be doing tonight.
No, I feel bad for staff that calling them a special meeting, but I think it was quite appropriate to do so given the circumstances. So
Yeah.
thank you, everyone. Happy Thanksgiving. We are adjourned at 9:04 p.m.
Thank you.
Good night.